Welcome to the webinar, Promising Practices in Providing Person-Centered Trauma-Informed Care During a Pandemic. My name is Leah Miller, and I'm the Associate Director at the JFNA Center for Advancing Holocaust Survivor Care. Each month for the last 4.5 years, I've coached agencies on how to make their practice more person-centered and trauma-informed. But there's never been a month like this before. The volume of death is heartbreaking. Many New York agencies don't even know the number of survivors who have passed because it's multiple per day or week. Survivors who have heart attacks and other critical medical needs are rejected by hospitals that are taxed focusing on COVID cases. Agencies don't even know if survivors die from COVID or from other causes. And Holocaust survivors are dying alone. Family members can't visit them. Widows and widowers and other family members are grieving, and dead bodies are stuck in transit and can't be buried, so there's no closure. So with that, I'd like to dedicate this webinar to a Holocaust survivor who I met a couple years ago on a site visit. William Gil is from Kiev, and he graciously hosted me in his home, and we shared tea. He told me about his work as an engineer before he immigrated to the United States, and in the 80s with his wife and daughter. And he came to the Jewish house of Bensonhurst 30 years ago. And in the words of Maya, the director of the Center for Holocaust Survivors, he instantly became indispensable. He was a leader, a volunteer, a person of the year in New York, a housing president, community champion. In his sun-filled small New York apartment, you saw some of the mementos from the old world, and his walls were papered with plaques of gratitude for his service. So with that, I'd like to dedicate this webinar to Vilya Gil, and he passed away from COVID at the age of 90, which is a giant loss. So while I'm working safely from my dining room table at home, and remembering my decade of service as a case manager, I'm keenly aware that the first call many Holocaust survivors make when they have urgent needs is to social service staff, who serves as their extended family. Many Holocaust survivors don't want to worry or bother their biological family. So on behalf of JFNA, I would like to thank you for working harder than ever to keep up with the needs of our clients. Many of you are primary caregivers and care for your children and parents, and also, who are also sometimes survivors. And we recognize that many of your spouses, like mine, have been laid off. And so it's a financially challenging time as well. But even through all of that, each call has given me more perspective on how inspiring our colleagues are and how creative agencies can be. The one story I keep hearing from staff across the country is how Holocaust survivors are calling staff to make sure that the staff is okay. They too are acting as extended family members. So based on the feedback that I've had from subgrantees, and we've heard about how Holocaust survivors' history of trauma exacerbates it, but the three primary needs of Holocaust survivors in these times are access to food and meals and groceries, because survivors can't go to the grocery store safely. And of course, safety is a primary tenet of person-centered trauma-informed care. They don't always feel safe providing the PIN number of their SNAP debit card to caregivers, especially in this time when we're telling survivors to be careful of fraud. They're triggered by seeing empty shelves in grocery stores and are concerned where their next meal will come from. And they don't want to let new professional caregivers, strangers who they don't have a relationship, into their homes. And some survivors might receive groceries but don't feel strong enough to cook a meal. The second issue that we've been hearing across the country is access to safe and reliable home care. Survivors don't trust some home care workers as being as safe as possible. They have to rely on public transportation or have to maintain multiple clients. And so some survivors are refusing home care services, and they don't feel safe letting a new home care provider into their home. It's taken a while for our agencies to develop trust with survivors. The third main need of Holocaust survivors, after access to food and access to safe and reliable home care, is social isolation. Survivors are more vulnerable than ever to scams, as they just want to have a personal conversation, Even a family member of mine who knew that she was being scammed refused to stop talking to the scammer because she just wanted to have that relationship with somebody who wanted to know how she was and get to know her. Many survivors spent Passover and Yom HaShoah alone for the first time in years, and they cannot see their families. They haven't even touched anyone or seen a familiar face in weeks. So all of these are the reasons why we are here today. Slide 2. Next. So on the next slide, you're going to see the definition of person-centered trauma-informed care. And so what I've been so impressed by is that our agencies, as always, have come up with innovative ways to address survivors' needs in these challenging times. So as you jot down the notes on the screen of the definition of person-centered trauma-informed care as defined by our very own Dr. Bedney and our former colleague, Michael Eisinger, I'd like to share some of SAMHSA's key principles. And you'll hear these repeated over and over again in the presentations that are coming up. Safety, trustworthiness and transparency, peer support, collaboration and mutuality, which is like partnering and leveraging the power field, empowerment, voice is choice, and cultural and historic gender issues. So on this webinar, we want to share some of the promising practices that we've heard. And so our goals are to share how agencies are preventing social isolation in a PCTI way, how they're helping Holocaust survivors access nutritious food in a PCTI way. Of course, PCTI is person-centered trauma-informed. How agencies are ensuring safe and reliable home care, and also how they are modifying services during these times. Slide 3. So I'd like to take a second to introduce each speaker. We have chosen some of our subgrantees that have really stood out in the innovations that they are providing and how quick and agile they're adapted their services to meet Holocaust survivor needs. So we have Carly Brewski from Greater Philadelphia, JFCS, Leah Bookbinder from the Jewish United Fund, Jewish Federation of Metropolitan Chicago, and Milana Hazan from the Blue Card. You can learn more about their backgrounds in the invitation that we sent you, and we'll also send it after this with the recording of the webinar. So for Delta and Echo subgrantees, please stay on until the end at 2:15 p.m. so you can get the code word to prove your participation. This webinar will be recorded and it will be posted on our website. So with that, I'd like to pass the mic to Carly.
Okay. Thank you, Leah. Hi, everyone. My name is Carly Brewski, and I am the director of the Holocaust Survivor Support Program at JFCS of Greater Philadelphia. Next slide, please. As Leah was saying, we at JFCS really have a commitment to the PCTI initiative, and everything that we do in terms of program planning and implementation of those programs is based on those SAMHSA 6 key principles of trauma-informed care that Leah was talking about. Safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So everything from direct service to our health and wellness programming to our COVID specific services are all being thought through from this perspective. Next slide, please. So what I'm going to talk about today is two-pronged. First, I want to go into what we at JFCS are doing on an agency-wide level as we've moved online due to COVID, as well as what we're doing specifically for our Holocaust survivor clients. Right now, we have about 440 open, active Holocaust survivors. So when I get into our services directly to them, if you could just keep that number in mind, that would be great. So on an agency-wide level, we receive very generous funding from JFNA through the Cohort B and the Cohort D initiatives In cohort B, we had a staff-wide year-long training in trauma-informed care. So once a month, we had a training over the course of a year in generalist trauma topics. After that year of training, we decided we needed some sort of governing body, like a steering committee, that would keep us accountable to everything we learned during that year of trauma training. So that committee here at JFCS has become known as the Sensitivity and Trauma Committee, or SIT for short. Our mission statement is here on this slide. Our vision is to acknowledge the rewarding yet challenging work we do every day and be the voice of all JFCS associates. Our mission is to cultivate and support the evolving process of ensuring a trauma-informed and culturally sensitive workplace. We will work to identify best practices around self-care and trauma sensitivity, find creative and diverse ways to nurture relationships with our clients and each other, and be responsible for upholding effective self-care techniques in relation to our coworkers, environment, and ourselves. I know that's a lot of information, but I just wanted to put it on there because we recruited members of this SIT committee from across our entire agency. So every department, every level of worker, and we brought those people together again to keep ourselves accountable to what being trauma-informed means and to really change the organizational culture in the areas that need to be changed. So as COVID hit us, as the SIT committee, we felt a real obligation to support the staff in any way we possibly could. So one thing that we did, and what I think is replicable for other agencies, is we created an electronic newsletter that goes out quarterly. So we sent one out already, and what was in there were things like academic articles around COVID, how to keep yourself safe, tips for self-care, articles on toxic positivity and boring self-care, quote unquote. So staff found that really helpful. We also shared recipes and fun content and stories of what we're doing on the weekend and accomplishments that we've had at home. So we found that we got a lot of positive feedback from the staff around feeling connected to one another and a little bit less isolated as we all work from home. So the quarterly newsletter, has been a real success. We also included feedback from our staff. We want it to be for staff, by staff. So when staff reports back to us that they find things helpful, like links to support groups online, we make sure to include those in the newsletter. We send out information about our employee assistance program. We send out links to live concerts that are streaming, live workouts, live Instagram dance parties. So anything that we think staff would like goes into this newsletter, and that goes out to everyone. Additionally, each day from 12 to 1, we have a Zoom lunch that is optional. People can join, eat together, talk or not talk. Some people just kind of sit there just to hear what's going on and not even be a part of the conversation, just to be present in some way, which is totally fine. And we also have Connection Club via Microsoft Teams. So that's really just a place to post, again, fun content, things people are doing at home, ways people are staying active, busy, positive, pictures of our pets. There's a lot of pets, a lot of animals, and a lot of recipes that go on there. So that has been something that the committee has felt very strongly about doing, and something that the staff has written to us and said, I feel like this is very personal to us. It's very thoughtful, and please keep doing it. Next slide, please. And then more from the admin perspective, agency-wide, I'll just go through this real quick. Some things that we're doing as we're in the midst of COVID. We've expanded our care navigation staff and hours. So it was a 9 to 5 intake line here at JFCS Philadelphia. Now it's 8 to 8, and we actually added 3 additional employees to staff the live hotline. We also have a warm line that we just opened on April 20th. That's from 9 to 5, and that's for non-clients. So people that are not currently clients and people that really aren't interested in becoming clients, they're still able to call and get support from a live individual representing JFCS. We've started a friendly caller program comprised of volunteers. These volunteers have worked with JFCS in the past. They've worked with clients directly, and most of them have some sort of social work background. So we feel very confident that they can call clients, and refer back to a social worker in a very trauma-informed way if that becomes the need there. We have ongoing training for staff, things around benefits, public benefits, enrollment, financial empowerment. We are really recruiting from inside JFCS, so people with specializations are doing trainings for the whole staff to make sure that we all know the new news, you know, what resources are really beneficial for clients right now, and then how to access those successfully. Lastly, and something that I really love our agency for, our CEO, Paula Goldstein, has been doing daily emails or recording videos of herself talking to the whole staff and posting those and sending those out, just motivating us, checking in with us. She specifically reached out to the new hires and made sure they feel supported because they were new to the agency when COVID hit. So she really wanted to make sure that they were feeling okay. So I've heard a lot from staff about how they feel extremely supported by our CEO and our executive team as a whole. Next slide, please. We are very lucky to have some very generous funders, JFNA, of course, the Claims Conference, Kavod, some local organizations such as Seed the Dream and Jewish Federation, and they are providing us with COVID-19 specific emergency assistance. So some of the things I'm about to talk about in terms of direct service come from these funders. Next slide, please. Our biggest, I would say our most robust direct service right now is for food access, as Leah was mentioning at the beginning of the webinar. We wanted to make sure that we were tackling this in a variety of different ways. We were offering as many options as possible. We were being trauma sensitive. We were being culturally sensitive. So we came up with a few different initiatives under food access. We're sending out grocery store gift cards. So a lot of clients, home health aides or their families are utilizing these and bringing the groceries directly to the clients' homes. We've mobilized some volunteers around grocery delivery to clients across the entire agency. So our kitchen manager is putting packages and boxes together for our survivor clients with food as well as supplies that she's able to access. So toilet paper, paper towels, trash bags, hand soap, dish soap, anything that she can get in bulk, we're sending out. We're also sending out clothing bags if needed. We have a program at JFCS called Our Closet where they receive clothing donations and then they do pop-up shops around the community. So since those pop-up shops really can't happen right now because of COVID, we're sending out bags of clothing or a pick-me-up, like a little piece of jewelry or a scarf or something that would bring a smile to a client's face. We're sticking those in the grocery bags, and that has had a really positive impact as well. We're partnering across the board with agencies across Philly, and those have all been really beneficial partnerships. We have some amazing networks here in Philadelphia. ElderNet is providing through their Animals program with us. They're giving free pet food and pet supplies to our survivors that have animals, specifically to our survivors, which is really nice. And something else that we've been so excited about lately is we have this new partnership with the local Russian grocery store, NetCost. I'm not sure if NetCost exists across the country. I know they're in New York and of course they're in Philadelphia, but they're extremely popular with our FSU clients. So we've been able to form a partnership with them where they're able to send out 20 grocery bags a week. So we're working in cohorts, 5 different cohorts, where each week 20 clients get Russian products from the Russian grocery store. And I have to tell you that the client feedback has been really touching. Multiple people have said they've been brought close to tears or actually brought to tears and overcome with emotion, being able to receive a culturally appropriate or a culturally sensitive product from a Russian grocery store. It feels very personalized, very thoughtful, and it's just something that has made a gigantic impact. So we're happy to be able to do that. Next slide, please. I'm going to hurry along. I have about a minute left. As far as in-home care services, we've been very lucky in Philadelphia to not have too many vendors pull out of the homes of our Holocaust survivor clients. We've checked in with each vendor and they're all following CDC guidelines. They all have access to as much PPE as possible, masks, gloves. I know sanitizer is not as readily available as people would like, but they do feel like they are protected and our clients are feeling comfortable with the people that are in their homes. Of course, we're checking in regularly with both the vendor and the clients as well. Next slide, please. And then lastly, just one other thing I wanted to mention, and it's another newsletter, but what we're doing for clients, and it's something tangible, is sending out a monthly newsletter just during COVID. So the staff, the Holocaust survivor team, is writing up articles. We have our nurse practitioner writing an article. Our internal rabbi has written up an article on mindfulness. We have clients that are emailing or texting us pictures of artwork or knitting or things they're doing at home, and we're putting that in the newsletter. And we're sending those out every month. So it's about 5 or 6 pages, program updates, how clients are staying positive, how the staff is doing. And I think in May, we're going to do a big piece on Liberation Day or Victory in Europe Day and include some photos from previous Cafe Europas in there. So again, the newsletter has been very, very successful. We've gotten a lot of positive feedback around it. Clients really like it. They like getting the mail. They like being able to touch something, read something. And it feels to them like we are thinking about them constantly, which we are. So I think I spoke very, very quickly and threw a lot of information out there, but that is my piece. So please feel free at the end to shoot me any questions that you might have. And thank you for listening to my presentation.
Thank you so much, Carly. So we're going from Philadelphia to Chicago, where we'll see Leah Bookbinder. I encourage you that if you have questions for Carly, please type them in the QA bubble at the bottom of your screen. And at the end of the call, we will answer the questions and Carly will stay on to answer them. Leah.
Thanks. First, I'd like to thank JFNA for the opportunity to talk about what we're doing here in Chicago. I'm truly honored to be presenting to so many of you who are actually doing the critical work at this time. Next slide. So first, I just want to give a little bit of background about the community in Chicago. The most recent Jewish population study estimated there were 6,000 survivors living in the Chicago area. We believe that number isn't exactly accurate because it was captured before the definition of survivor was expanded to recognize those from the former Soviet Union. JUF has both a macro and micro role in supporting survivors. Holocaust Community Services is the local program dedicated to serving survivors. And it's a JUF program that is fully administered by CJE Senior Life, which is the local Jewish elder care agency. We also have a Jewish family service agency here, but 40 years ago, we spun off our own Jewish elder care agency, which is CJE Senior Life. JUF is also the grant recipient from the Claims Conference, but again, all services are actually provided by Holocaust Community Services. In 2019, JUF was one of then 7, now 8, I believe, federations to receive a critical supports grant to launch a leadership council to develop strategies and services to prevent and resolve crises among Holocaust survivors using a PCTI approach. Next slide. This just shows a little bit of an overview of who we invited and who was participating. The Critical Supports Grant created a new opportunity to reach beyond JUF's common partners. The goal was to teach these organizations what PCTI means and looks like, learn best practices from organizations providing care to a variety of older adults, including refugees, vulnerable populations, and of course our survivors, learn what gaps existed for survivors, and then release an RFP to fund programs to address those gaps. As always with federations, goals, and leadership councils such as these, we're striving to create shared learning opportunities, build personal connections, and create new partnerships. Next slide. In the first year, we had what now feels like a very typical process. We had some meetings, we identified priorities, we developed an RFP, and we awarded grants. Great, done. Year 2 started, and we thought we would do the same as. We had our first meeting at the end of February 28th, I believe, and we planned to hold 2 more meetings before releasing an RFP. And of course, the plans quickly changed. We decided that we realized immediately that this group could be crucial for sharing information in these times. Of course, we know now that things shifted very quickly with regards to best practices around social distancing. In early March, however, while a lot of the agencies were following and tracking what was happening on the East Coast, nothing was yet mandated in Illinois. So we decided to use this group to discuss what organizations were doing at that time. We happened to have reached out the week before Illinois put into place its stay-at-home order, which was March 22nd. This created an opportunity for Leadership Council members to connect, which is itself a PCTI principle. Next slide. So how did they respond? So the primary concern for agencies was clear. How do you continue to help clients while keeping them safe? Organizations shared how they were still conducting assessments by phone, following different practices in terms of maintaining HIPAA regulations and privacy concerns, which services were continuing, which ones weren't, and what shifts were being made. PCTI clearly factored into the mechanics between each of these shifts. PCTI principles emphasize the need to clearly communicate with clients what changes are being made, empowering them with the why, and clearly articulating how this is keeping everyone safe. It's important that communication wasn't just about the individual client, but about the collective, that we're all in this together. This gives clients a sense of control, consistency, and reliability, which of course are key principles of PCTI. For communication and contact, agencies shared how they were navigating serving clients by listening to what individuals were saying they needed and not just deciding it for them. After all, again, that is PCTI. Some clients might, when people were reaching out to offer phone calls, some clients wanted long calls and conversations. Others wanted frequent short check-ins, knowing that another call would be coming within a day or two. And some didn't necessarily want any. Some clients were also open to calls from volunteers, and here in Chicago, we've had a lot of success with individuals reaching out to us saying, hey, we want to help. But others may not, and that's okay too. I wanted to share from Holocaust Community Services, they have a client who's hard of hearing. And so the care manager decided to send the client a letter. Now the survivor has a tangible reminder that someone is thinking of her and she's not alone. That might be a bit outside of the standard box of how we provide services to clients, but that's entirely the point. With regards to food, we know that concerns around food access and security, as Leah Miller mentioned, are very triggering for survivors in particular. As Dr. Hoffman, Director of Holocaust Community Services, has said, they may be worried about food now because they were hungry then, and we need to help them with the real needs as well as the anxiety triggered by the past. The challenges and changes required through social distancing have necessarily reduced client choice. So agencies have gone from providing client choice food pantry models to prepackaged food bags and gift cards. While prepackaging food limits clients' choices in what they eat, by informing them of the reasons why, clients are all understanding about these changes and they appreciate the ongoing access to food. Clients who are at higher risk of contracting the disease and need to remain at home are receiving deliveries from staff or volunteers, so they don't venture out. And again, all of these shifts are for the safety of clients and staff. It's important to emphasize that mutual consideration because it's empowering, which is again a principle of PCTI. In addition to sharing what was being done, organizations reached out to each other for help. As many of us as staff and people who are farther removed, especially someone like myself, I'm not providing direct care. As we're all feeling a bit powerless around what's going on, it's empowering to share what we're doing to help each other when we're able to. Some examples include an organization locally which provides food for Passover delivered by volunteers pivoted to providing gift cards, but expressed a need for Russian-speaking volunteers who could help respond to any questions that they might learn of. And someone else responded, hey, we can help. A nursing home asked for help securing iPads so residents could connect with family, and sharing transparency on Facebook and other things so that the family members knew that their residents were safe. One organization reached out to another to strategize how they could together coordinate services to the survivors in a subsidized housing facility. Next slide. I wanted to end with just a few examples from our sub-grantees. Generations Housing Initiatives, which is in the ECHO cohort as well, I believe, has shifted from in-person caregiver support groups to creating packets with self-care items and education pieces with activities and individual follow-up for the caregivers. And they're exploring shifting and continuing these programs and services remotely. Again, helping to ensure that the caregivers don't feel abandoned will in turn help our survivors. The ARC has shifted again from a client choice food model to packing food bags and delivering them to people at home as needed. Holocaust Community Services had planned to launch support groups for family and non-family caregivers of clients at CJE's Skilled Nursing Center. With the CDC required restrictions on visitation, staff has instead been providing remote support, both to maintain the program's connection with their survivors and with the staff themselves. I want to end with a story about what other thing that HCS is doing. They're preparing a mailing to send out PPE to survivors and their caregivers. So besides CDC recommendations and requirements of wearing masks in public, this is about empowering survivors. Care managers had been hearing from individuals living in subsidized housing facilities who were not feeling safe to leave their facility because they would have to go through communal spaces. In particular, one survivor with a lot of medical conditions hadn't left his home in a week, even though he wanted to go for a walk, but he was too afraid. But I want to continue. Not only is HCS empowering them by providing them with the necessary materials, but this client and the care manager talked for a little bit. I want to thank Maya for sharing this, if Maya's on the call. So the survivor shared that he could walk past an open window in his apartment to get some fresh air. He said he'd go for a walk by the window, back and forth and back and forth. But then he added, since he had 4 or 5 steps between, the space to his window, maybe he could take his wife for a walk, and maybe that could lead to a dance. It's really important that for survivors, this isn't one size fits all, which is exactly what PCTI is about. It's about listening to survivors, hearing what they're saying and what they're not saying, and not just making assumptions for them. It's about coming from an assets-based mindset and not a deficit mindset. We're all vulnerable now more than ever, but we all have something to contribute. And that's really what's best and most helpful about the Leadership Council at this time. We're struggling in different ways, but by sharing what we're learning and doing, and on calls such as this, we can all empower each other to help each other and ultimately better serve our survivors. Thank you.
Leah, thank you so much. I love picturing the Holocaust survivors dancing in their living room. From Chicago, we're going to go to New York City. Milana Hazan from the Blue Card.
Hi, thank you, everyone. My name is Milana with the Blue Card in New York, and I just want to say thank you, Leah and team, for organizing this webinar and the opportunity to present our work. It's really amazing to see all the agencies nationwide come together during such a difficult time. So really thank you, everyone, for everything that you're doing. As many of you know, the Blue Card is the only organization in the United States with the sole mission of aiding needy Holocaust survivors. So there's really so much that I wish I could cover. I know we're pressed with time, so I did share my contact information right there on the screen. So if you have any questions, please feel free to reach out to me directly at any time. So next slide, please. What really sets the Blue Card apart is that our sole mission is to help Holocaust survivors who are living either at or below the poverty level. So these are really just some of our programs in a nutshell. These are the categories, but there's at least 12 programs that we have for the Holocaust survivors. Really, the goal is to ensure that all their needs are met. And, everybody has a different situation that they're in. No two survivors are really in the same situation. So because we're a national organization, we sort of have this snapshot of what people's needs are, and we're able to create different programs as a result of that. So we have the claims conference, the very generous claims conference funding that we receive that allows us to make sure Holocaust survivors remain in their homes. We have the emergency prevention programs, the health and well-being programs, and the educational and outreach programs. And that includes actually the JFNA's PCTI program, which we're so grateful for. So next slide, please. So with the current epidemic, I will be actually focusing primarily on food and isolation prevention, but I just want to kind of cover some of the things that we have been doing in light of the crisis. So, essentially we started with supplies to, a few survivors locally that are in New York, but somehow the list grew to 2,500 Holocaust survivors. And it was amazing to be able to provide the essentials like tissues and toilet paper, bleach products, so on and so forth. So one of our biggest programs is the Telephone Emergency Response System, the TERS unit program. That's that help I fall and I can't get up button. So it's really been a very strong program of the Blue Card, which we established over 11 years ago. So in light of the current crisis, as we're encouraging Holocaust survivors to stay in their homes, we really are providing more and more of these units. it's reminding survivors they're not alone, and the unit really has been a lifeline for these individuals. It has really allowed them to stay safely and independently in their homes without any fear of being left alone. So it has really, it's really a life-saving unit. So we've been really fortunate to work with providers who are just so dedicated to the Blue Card's mission. So they provide check-in calls to our survivors to make sure everything is okay. And if those survivors who need help, Blue Card will reach out to them directly to, to provide whatever help they may need, be it additional financial support, be it food assistance, whatever it is, the Blue Card staff will take care of it. Okay, and we also provided additional grants for food and hot meals, as well as food deliveries for survivors who are living remotely. So meaning Blue Card service staff will make sure that these people will receive their food deliveries. We also have our psychotherapy and emotional support program. So what we've done is we've actually are working with many psychotherapists across the country who are providing emotional support to Holocaust survivors. And again, just to encourage survivors to stay in and make sure they're not leaving their homes, we have our prescription delivery and copay assistance. Okay, next slide, please. Okay, so again, just to focus a little bit more on nutritious food in a person-centered trauma-informed manner. We're working with agencies, and this is really where the partnership comes together. Survivors and agencies are reaching out to survivors in their communities and making sure that they receive hot and fresh daily meals that the Blue Card will actually is paying for. And as I mentioned before, we're providing additional financial support so survivors can purchase food that they need. So, in many areas, caregivers are still continuing to work, and family members and volunteers will run errands for survivors. And also, like I mentioned before, in remote areas where survivors don't have social workers, Blue Card staff works directly with those individuals to make sure that they have groceries and meals. Okay, next slide, please. Okay, so in terms of providing against preventing social isolation, we have spent countless hours working with our service providers who check in with our Holocaust survivors. Reaching out, Blue Card staff members will reach out directly, make sure everything is okay, and respond in a very quick manner. We also, again, just to encourage survivors to stay in their homes, pay for survivors' medication copays and deliveries. This will allow them to, again, stay in their homes, make sure they have their medication. And we also work with a therapist. So this is a second-generation Holocaust survivor who is working directly with our survivors. She checks in with them some of them via Zoom, others via telephone, to make sure that they know that they're not alone. Okay, and that's really it for me. And if anybody has any questions, please let me know.
Thank you, Milana. We appreciate the input from Blue Card. So from here, I want to introduce my partner in crime, Amanda Jarvis, who is the Assistant Project Manager. Before that, I'd also like to give a shout out to Amanda Barmash, the Project Assistant, who is instrumental in making sure that all the technology of this program and communication works. Amanda Jarvis.
Hi, everyone. I'm Amanda Jarvis. Can everybody hear me? Okay. So feel free to type any questions you have into the Q&A section at the bottom. I see that Carly's gone through and answered a lot of questions aimed at her. And just for the sake of making sure that everybody can get some of these answers, I'll read a few of them aloud while we wait for questions to come in. So let's see. One of the great questions that I see is, how are you engaging clients who don't have technological ability? A way besides phone call check-ins, but for people who can't do Zoom. And Carly responded, that we have a low-tech community, but we're advertising Uniper for those who want it. We haven't tried survivor-specific virtual programming yet. Most clients don't use Zoom though, otherwise you spend a lot more time on the phone these days. And then somebody said, well, what's Uniper? And Carly said, it's a program that was created in LA. It's a system for older adults and vulnerable clients that are homebound and isolated. It has virtual programming and uses WhatsApp to connect people. If you're interested, Carly is happy to send you more information. So I see that a few more questions have come in, and I'd like to welcome any of the speakers to speak up and respond if they're not aimed at a specific person. What precautions are you advising your clients regarding wiping down packages of food being delivered?
So this is Carly, I can answer that. Well, I can tell you that from start to finish, we have some safety precautions in place. From our building where we're sending out JFCS packages, we're practicing social distancing, we're wiping down products before they are even put into volunteers' cars. The volunteers are then using gloves and delivering them to the client's doors. They're not going inside the homes. So there's all kinds of things that are being practiced beforehand. Same thing with our JFCS bus and bus driver that's doing the net cost / Russian grocery store deliveries. Everything's with gloves, masks, protective equipment. We do recommend to the clients that when the groceries are brought in that they wipe them down, but I mean, we only have so much control over whether or not that's actually happening. You know, I think the aides are crucial, the home health aides in things like this, because they are, you know, hyper aware of what should be happening in terms of safety and disinfecting. So, so we make those recommendations, and then on our end, from our volunteers and staff perspectives, we do everything we can up front in terms of sanitizing.
Thank you, Carly. The next question is for Milana. Does the Blue Card fund other organizations to deliver meals during the COVID-19 shutdown?
Yes, we do actually. And we have helped many agencies, I believe at this point over 20 agencies, with a grant to provide whatever support that they need. You know, again, on our end, we delivered different kinds of supplies and food and medication. But again, every community is really different. Every person's situation is very different. So again, be in touch with me directly. Give me the number of people that there are in your community who are in need, and what the needs are, and we'll discuss that privately. But yes, definitely.
Thank you so much, Milana. There's another question for Carly. How does net cost work, and is it available in New Jersey?
I don't know offhand if it's available in New Jersey. I know that they are headquartered in New York and that we have 3 sites in and around Philadelphia. You know, honestly, I just cold called them and created the partnership that way. So even if you don't have net cost, if you have a local store or shop that you think would be able to serve survivors, you know, they were just give them a call. But they were more than happy once I said that this is specifically for Holocaust survivors to engage with us. And they actually ended up donating a lot of dairy products to our packages as well, just because they want to help the cause. So short answer, I'm not sure, I'm sorry, but you know, you can just look on their website or see what is available in New Jersey and just reach out to them.
Thank you. A couple of people spoke up and said that there's a net cost in Paramus, New Jersey. So that's good to know for sure. A very poignant and timely question is, how have any of the speakers addressed the specific challenge of anxious and distraught family members because they can't visit loved ones? For example, in long-term care facilities, visitation has been restricted for all guests.
do you mind if I jump in? It's Milana, actually.
Absolutely, great, thank you.
So, such a devastating situation. And I know, like, you mentioned this earlier when you started speaking that, people have been alone on Passover, all these major holidays. It's really just such a sad situation. But what we do is when I speak to survivors and their families, really just keep reminding them this is for everybody's safety and well-being. Of course, it's so devastating to have to be alone. I haven't seen my parents in weeks, and with my in-laws, we're just kind of cooped up at home. So we just remind them it's really a matter of time. Hopefully, all of this will be ending soon. And also remind them that if they need help in terms of, Zoom or, maybe having a laptop or an iPad, we can, help with that as well, to just kind of comfort them and let them know there are solutions.
Thank you. A question for anyone. How are you getting ready for the re-entry back into more of a normal life? For those who are doing telehealth therapy, are you hearing that it will continue?
This is Leah in Chicago. I have to admit that I don't think most of our agencies are thinking about that quite yet. Although there was a legal, there's a legal procedure going on, which might change it. But at this point, Illinois has extended the stay-at-home order at least until the end of May. So I don't think we're quite there yet for thinking about it. I'd be curious what Carly or Milana are hearing or are able to share, particularly around large-scale events, as so many communities are considering whether or not even the fall will be safe enough.
Yeah, it's Milana, sorry. And I agree, I definitely agree with Leah. We don't know what's happening, and the same thing with New York. For now, we're just shut in until May 15th, but we really don't know what's happening. I think right now we're just focusing on taking it one step at a time and, just trying to move along as best we can.
Thank you. This is a question for all speakers. We are very interested in what other agencies are doing with helping seniors access PPE. Can you please elaborate on including written materials you have sent about how to use them? So how have you helped seniors access PPE, and do you send written materials explaining how to use that PPE?
This is Leah in Chicago. Holocaust Community Services is sending out a mailing, and I'm sure I can reach out to them to ask about sharing it with the community, which includes some of the regulations from the CDC. They're sending out small amounts of PPE because their caregivers are primarily not through home health agencies. And so unlike in Carly's community, they don't have somebody providing the PPE. JFNA and NJHSA work together to secure a good amount of PPE for a lot of communities. That's not how Holocaust Community Services did it, but that is a potential resource.
I see a lot of questions regarding Uniper. And Carly will be able to answer them offline later, and we can also connect you with her. But something to keep in mind is if the survivors don't have Uniper right now, they end up needing to have already a device that they can use and know how to use the video and know how to use the audio and have an email address. So all of that would be necessary if they don't already have Uniper. Is that your understanding as well, Carly, at this time, if it's web access? Leia's shaking her head yes, and I know that's happening.
And I think it's for NJHSA, and there's another agency. Is it the Aging Jewish Service, AJSA member organizations, right?
Agencies? Yeah.
Yeah.
Okay. Carly, do you have anything to add to that?
No, you're right.
Okay. The other thing that I've heard of for non-technical ways of engaging survivors is I've heard of snail mailing. This is from Pesach Tikva. They snail mailed directions of how to use a conference call, and they had survivors singing all together on the conference call line. So that was one way that was slightly less technically involved because it is just a telephone that you would need, and it doesn't have to be a smartphone, that was successful in one community.
Thank you so much, Leah, for explaining. So a couple of updates, housekeeping, before we get back into the questions. Somebody noted that there is a net cost in Manalapan, New Jersey. So that's good to know. There's going to be an upcoming webinar about Uniper. We will give you a heads up before that so that anybody interested can learn about that. Let's see. Oh, we just got a bunch more questions. So one of them is for Milana. Is the iPad sharing program like a rotating basis, like a library, or something else?
Oh, sorry, just to clarify, in terms of the iPads, we're not actually distributing iPads. I was just responding to a question earlier that, explaining to survivors there are solutions, we can help them if they need an iPad. That's something we can always reach out to private donors to help us provide to survivors, but it's not one of our actual programs where we have, an iPad distribution. A lot of these people have their own, a lot of these survivors have their own iPads or computers or laptops, and we will connect them with a staff member to walk them through the actual process of how to get Zoom set up or how to get Skype set up.
Thank you, Milana. A question that came in says, how do you overcome challenges to deliver hot, kosher food instead of non-perishable food?
So this is Leah. In Chicago, one of our agencies, the Dinah and Eli Field Ezra Multi-Service Center, actually has a food pantry which provides hot kosher meals in their cafe. They have transitioned to offering those to their clients as deliveries, so they can get either pickups or deliveries. They're all prepackaged. And CJE also provides home delivered meals which are kosher. It doesn't exactly address your question because those were existing mechanisms that have simply been shifted. So I'm not sure if Carly's doing anything different.
Most of our, so yeah, I agree. Most of our deliveries are non-perishables or frozen. We're not really doing a lot of hot meal delivery. We did around Passover. We went through the local JCC and we worked with their volunteers and our volunteers together to deliver Passover meals. But that was really, a special situation. It's not an ongoing service right now, unfortunately.
Thank you so much. So there's actually a webinar on Uniper tomorrow at 2 p.m. Eastern Time. Shelley posted the link in the Q&A section. And so we can also include that with our follow-up materials. Keep an eye out for that. A couple more questions before we move on. Let's see. Is anyone creating a survivor-specific senior center online?
Self-Help has something along those lines with their virtual senior center and has for years been a leader on this front. So that's one place that may be able to help with that. And I would also say that Los Angeles, they kicked off the Uniper. They were one of the first agencies, as well as Broward, and they may, Goodman JFS also has been doing Uniper for a while, and so they have something that's similar to a virtual senior center there too.
Thank you so much, Leah. Another question. A quick update. Ellie Castell from the Borough Park Y, one of our ECHO subgrantees, is providing a conference call 6 days a week with exercise learning and support. So while it's not online, it is on the telephone line, and I'm sure she would be happy if you wanted to reach out to Ellie Castell to ask any questions about how that's going. So I don't see, let's see. Yeah, so I'm not seeing any more questions that we haven't already gotten to. And as always, you can email holocaustcenter@jewishfederations.org for any questions that you might have or technical assistance that you need. Let's see. So I'll keep an eye out. Oh, somebody said, are any of the virtual senior centers available nationally? That's a great question. Leah, do you know the answer?
If the individual who wrote that wants to write the Holocaust Center at jewishfederations.org later, I'm happy to answer it. I think we're in discussions about that right now.
Thank you so much. So I think that that is a really ending to the question and answer segment. If we did not get to your question or you feel that it was not answered in full, please email us. Again, holocaustcenter@jewishfederations.org, or feel free to reach out to the speakers that posted their information or any of the commenters in this Q&A section that said that they had information for you. Next slide, please. Thank you. So next steps. So just a quick reminder, this webinar was recorded. We will be sending out the recording shortly. So keep a lookout for an email. We're going to send with the recording and a follow-up email with a survey. Our next JFNA webinar will be sort of an intro session. It's going to be an introduction to PCTI care, scheduled for Thursday, May 7th. And if you are or have ever been a member of our cohort, as always, feel free to log on to Piazza to share promising practices. I know that a lot of your colleagues have been active on there lately, sharing and trading ideas. And so Piazza is a really great resource, especially right now. Next slide, please. And so another reminder to please complete the brief webinar evaluation survey that you'll receive in a follow-up email. And if you are a current subgrantee, you will verify your participation in the webinar with the following secret word. The word is together. And it'll prompt you to enter that word in the email. So to wrap up, thank you all so much for participating in this webinar. Your questions added so much to the discussion. Thank you to our speakers for sharing their time, expertise, and promising practices with us, and for giving us takeaways and tangible ways that we can help Holocaust survivors in our community. And thank you so much to all of our care workers in the front lines, bravely serving vulnerable clients day in and day out. You're the reason that we are all here, and you're the reason that we created this webinar. So thank you so much.
Thank you for the opportunity, everyone.
Thank you.
And have a great day.